I had an ex-boyfriend who used to snorkel me. Have you guys heard of that?
Snorkel.
Just randomly put his mouth over my nose when I least expect it and blow.
Oh, and
so
then
annoying.
That makes you snort sort of like
and then the air has to escape.
Right. What an idiot.
We're gonna have to do a whole show of Lydia's weird
weird
experiences.
Some weird.
God. I thought I was. Did he make you queef when he was like?
Oh God. Ew.
I mean, if he would blow in
I told you what makes me gag.
Oh no.
If he was blowing in your nose, would he not blow?
Oh Lord.
Okay.
The thing about so PA Lydia's sitting in GVAC's chair, and GVAC. One of the things that was fun about him is we could make him gag pretty easily when we started talking about scrotums and stuff like that. I know exactly what makes PA Lydia puke, and I won't do any of the other stuff, but I know what the other things are too. So anyway, so I have it. So
now
that
I've
was
got the image of like him making me
but the
queef. Thank you. It's fucking disgusting.
When I huff and I puff. but it was but him blowing in your nose wasn't a deal breaker.
So weird.
Yeah, but and evidently pulling your panties down without permission and
humping her
and
laying on top of her.
Not a deal
That's
breaker.
fine.
So I'm kind of
I'll give you a tip for that.
I'm kind of Jesse pays extra for that. It makes me.
I'm gonna write this stuff down.
Do Lydia that will really piss her off. That's what I want to know. It would make her run away.
All right, here we go. You ready?
I don't think so.
I hope everyone is doing well.
Hey, thanks.
I had a question about getting blood drawn.
Okay.
At your local lab or wherever else. In the past, I've had an issue with dehydration, not drinking enough water before going in, and either they had trouble finding the vein, or the drawing was really slow, like trickle in. And I just got out of it a little while ago, and the same problem came up where they tried a vein in one arm, didn't seem to catch, tried the vein in my other arm. Flow was good for the first 2 vials, but the third one was just a struggle, a slow trip. And between yesterday and today, I must have drank like gallons of water. Like, I'm sure it was overkill, but I am just shocked that it was a problem. And
he's trying to increase his blood volume.
I've seen her before. She's great. I don't want to call it, technician error, but I'm just curious. 2 things. One, is there anything else I can do pre a blood drawing appointment to make sure that this doesn't happen? Stay hydrated. How much hydration is enough?
No.
Should I try to get the blood flowing? Maybe do a couple of jumping jacks? I know it sounds silly, but would that help? And then second, I wonder if you could tell me what it is meant by a blown vein. When I was there a few months ago, the tech was having a different tech was having
blown vein.
Much more problems.
Okay.
Someone casually mentioned that, it was a blown vein.
Okay, well, we've got that. So, PA Lydia, you were never a nurse.
No.
But Mel B was a nurse for X number of years, 15, 17 years before you went to nurse practitioners.
Like 5.
Oh, only 5? Oh, okay.
No, anyway. No, about 7 years.
Okay, so this you can answer. Absolutely. So difficult, not only blood draws, but sticks for IVs. So talk about that for a minute.
Well, some people just have deep veins.
Yep.
And the needles are small and short. And sometimes it's just hard to get deep enough. People that are large in size tend to have deeper veins. So that's part of the problem.
Right. Well, they have more overlying tissue.
Right. And then you're also trying to hit a little tube that you can't see, that you can just feel.
Right.
So it's a gift. And some people just have it and can visualize these things. And
in the hospital, there's always that one person. When you have trouble getting something, they say, call, Sally June from the 5th floor. She'll come down and do it.
Yes.
Some people just have a sixth sense for that. I have a weird sixth sense that I can usually, if someone comes in complaining of pain, I can put my finger right where it hurts. Does it hurt here? It's almost right every single time.
Yeah.
And some of that is just intuition because I understand the anatomy and where
you
pain
can
comes from and all that
visualize,
stuff. Right.
You know, you can kind of imagine what you can't see.
Right.
And some people just can't do that.
Right.
Nurses are the same way. Some nurses can, and phlebotomists can picture what they can't see and imagine it there. And then you can hit the vein every time.
There are some. Yeah, go ahead.
Why do you think sometimes it's a slow drip?
Oh, I know. why.
It's
fluid dynamics.
Vacuum. Okay.
But you don't think it's maybe like the angle of the needle
Yes.
into the
Yeah.
vein, or
That,
possibly
it could be
or
a lot of things. So the
Yeah.
needle has a little hole on the end of it, and it's at an
an
angle.
angle, right?
You know, you've got a tube,
Has a
and
bevel
it's
on
not on the end of the tube.
Right.
It's the end of the tube's at an angle, so it's turned
Right.
sideways. And if you have that pressed up against the inside,
Let's slow it down too.
it slows it down because you're not getting a full flow.
Or if you're not fully in it,
Mhm.
or if because of the vacuum, the vein is collapsing because veins are thin walled and they are a little bit collapsible. Some people may have more collapsible veins, that kind of stuff.
What about if you have thick? I don't mean to keep interrupting you, but
No,
what
no.
about thicker blood? I mean, if someone has a little bit thicker blood?
The whole sort of concept of blood viscosity is a little bit of a myth. I mean, it's true that some people have slightly more viscous blood than others, like if they're dehydrated or something like
Myeloma.
that. And yes, and then people who have blood disorders, but the amount of viscosity difference, it's not like the difference between water, say, and honey.
Okay, got it.
You know, it's you would have to, you may even have to put it in a machine to measure it to be able to tell the difference. But you know, a blown vein, then talk about what a blown vein is. That's just one where somebody fucked it up.
Yeah, that's just where somebody screwed up.
They put a hole in the vein and it leaked.
Right. And basically you have a bruise now.
Yeah.
So, and your body clots and it stops these things so that you don't bleed to death from a blood draw, right?
But you can get a blood vein from drawing blood and from an IV getting fluids and stuff.
You can get a blood vein,
a blown vein.
Oh yeah.
Both.
No, absolutely.
It's just you can either go into the vein and then come out and it bleeds until it
or
clots,
go through and through,
or you go all the way through the vein, and then you've got blood coming out the other side,
right on.
and it just leaks.
Yeah.
Now, they do have ultrasound.
Right.
Have you ever? Did you ever use that?
I used a vein finder.
Yeah.
And it's like a light that
Like
makes things
projects
glow.
the map onto the.
Yeah.
Okay.
I tried to hold one of those for a nurse who was trying to get IV access on my daughter and passed out.
Oh, rats.
You passed out?
I did.
Oh, rats.
Embarrassed my poor kid. She was so sick.
God.
I don't do well with my own blood or the blood of my children.
Mom.
Yeah, that's pretty much
Yeah, that's
she
what I was
said.
thinking. All about you.
But it was. I did. I passed right out.
So
I don't deal well with their blood or mine.
Yeah.
But no, I've used a vein finder. I've used it for myself. I never really found them really helpful because I'm one of those people that can imagine it, that can see it. And it's like the one nursing thing I could do really well.
Now, I used to have really
That
good
was just
veins,
that
and
one thing.
I'm not a big person.
I can see your veins from over here, and it's getting me very excited.
Boy.
But one of the things that you can do,
nice.
if they're going to draw blood out of your arm, one of the things that you can do, jumping jacks won't do it, but what you can do is stand there, make a fist, and spin your arm around like, what was that?
Like a softball pitcher.
He-Man doll or
like
something like that.
Pitcher.
Yeah, like a softball pitcher. But go round and round and round and round. And through centrifugal force, you will fill up the veins in your arm, and you can see them standing out, and it makes it easier, an easier target.
Use gravity is another trick. If you've got somebody that's frail, elderly, very dehydrated, very, very sick, you can use gravity and let their arm dangle down, because then the blood,
and then they put the tourniquet on, and the tourniquet is there because arteries are muscular, high pressure vessels. They can push blood past the tourniquet, but veins are thin, low pressure, thin walled vessels, and they can't push blood as easily past the tourniquet. So you get more blood going in than you get coming out. Sounds familiar to the men out there who are taking Viagra and stuff like that. But the veins will pop out, and then you can, that's why they do that anyway. So, all right.
Getting very excited over here.
The veins.
It's funny what you get excited about. All
veins.
right. This person I think called for let me see if we got time for this. We do not. We'll do this one on the podcast. And check out our podcast anywhere where you find podcasts. Let's do this one on poison ivy, though.
Hey, Dr. Steve, it's Matt in Charleston. How are you?
Hey, Matt. Good, man. How are you?
That's good. We're doing good here.
Good, man.
Hey, so I'm dealing with some poison ivy. It's like a repeat issue for me because I spend a lot of time outside in the woods, and I'm extremely sensitive to it.
Yeah.
I've been hospitalized with it before, but it's
Ugh.
given me
Yep.
IV steroids to help flush it out, and obviously topical stuff. And I'm wondering how rare that is, or if that's all in my head or crazy.
Oh,
And also, how does calamine lotion work?
doesn't.
Does it just suck moisture out of your skin, or is it magic, fairy farts? What the hell is going on with calamine?
Yeah, calamine just basically dries things out. That's its role. And there'll be calamine with Benadryl in it or diphenhydramine, which people think, oh, well, this is going to be better because it's got anti-itch stuff in it. Actually, topical diphenhydramine or topical Benadryl can be activating and actually make it worse. So if you need an anti-itch and you want to take diphenhydramine, which will make you sleepy, if you got enlarged prostate, it'll affect your ability to urinate. But if you can take it, it's pretty good for itch, but take it orally. Don't put it on your skin. But no, it's not in his head. It's obviously real. Just get on steroids from the second it starts, and then you'll know.
Yeah.
Till next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. All right, there you go. All right, now.
Hey,
Yeah.
I gotta go take a phone call. I'll be right back.
Oh, okay.
Okay.
Yeah, just come back in and just put your, I'll put your, go ahead. All right, Dr. Scott. And then, yeah, get your ass back in here because you got to do the
Music,
your
baby.
music thing.
I'm just on call, so I'll be right
Okay, got it. The hell is she on call for?
Working for the
I'm on
man.
call.
Is that you?
Oh,
Maybe it's her daughter or something.
okay.
Maybe take a call. There you go.
All right.
We have one question, and there was one. Pescado Joe gave a thingy
A thingy.
A thingy.
for $1.99.
Okay, hang on. Okay. All right, Dr. Scott, before we get out of here, let's check Myrtle Manus, gifted 10 Weird Medicine Dr. Steve memberships. Remember to just click the join button at youtube.com/@weirdmedicine. And you don't have to join if you don't want to. It's 99 cents, but if you don't want to do it, but do click accept gifted memberships because Myrtle's always in there gifting them memberships. You know, she's a good, and I'll tell you that. And then Corndiff, member of 4 months. Thank you, Corndiff. Nice to see you, my friend. Corny is local and he started playing guitar. We need to get him in the studio, Dr. Scott.
That would be fun.
And then let me see. I'm going to do all of those things. Then you can scan for questions. Pescado Joe.
Yeah.
Thank you for the $1.99 super chat. I stand with Dr. Steve. This is a hot, sexy talk. Hashtag chub. So well done, PA Lydia.
No, I think
Way
that
to
was about you
go.
talking about the veins
Oh,
bulging.
you think no? I don't think so. I think there was some massage talk that got him going. So,
Mhm.
all right, so that's
I'm
what
glad
I've got
someone enjoyed
from
it.
that side.
That's right.
I enjoyed
I
it.
didn't. I mean, the
well,
event.
yeah,
Glad.
it gives you a good story.
Glad there's
though.
pleasure out of it. Yeah.
Yeah.
That was a good story.
All right, Dr. Scott, what do you got from the Fluid family? I see lots of sort of long posts. In there,
Yeah,
so-
but we do have one question.
Okay.
So we'll do that one
Yep.
from Golden George. And I think this is a good one for Lydia. How long does the bruising normally last after IVs? Took a few tries for the anesthesia, and they beat me up pretty bad.
Yeah. So can I answer now?
yes,
Yeah.
please.
Yeah. So
yeah.
bruises, typically a couple of weeks, you can see changes from bruising.
Right.
So initially they would be like a bright red color, purple, and then eventually fade into a greenish color as your body starts
And
to
then
break
yellow.
down. Yeah.
And
So
if it
it's normal to
fades
last for a
away.
couple weeks.
if you get a big enough hematoma where there's actual, collection of blood in one place, the body can get rid of everything but the calcium, and so you'll get a little
Mhm.
nodule of calcium left behind. But that's a really big one, like a car wreck on somebody's hip. They've got a big giant
Yeah.
hematoma. So
And a couple things to help with bruising, though. Topical stuff is arnica. Arnica it's not a prescription, allopathic medicine. It's an old, homeopathic medicine. It's in a lot of the surgeons, a lot of the vein doctors will use it for bruising. It works pretty well. Yeah, arnica.
Yeah. So bruising is just loose blood under the skin, and it'll travel around along sort of fascial pathways. In other words, pathways between layers of tissue. And if it's on your leg, a lot of times it will migrate down the leg, and you think, oh gosh, this thing's spreading, but it's really not. It's just the blood being affected by gravity. And so when they dig around in there, sometimes you get a bruise where they did it, and that's just part of it.
Yep.
Nobody's perfect at putting these needles in.
Yep. Hey, one last quickie just came in. One last quickie. Diesel Child wants to know: isn't it dangerous to blow air into a vagina?
Okay, so there is such a thing called an air embolism, but that is when the person is pregnant. Right.
Yep.
So let me look up vaginal air embolism, because you should not, when someone is pregnant and like 9 months pregnant, you should not be blowing air up their vagina.
No.
It's rare, potentially fatal, and it can occur when air is introduced into the vagina under pressure. And it can happen during, and I love this term, vaginal insufflation. Because that's what that is. So anytime you blow into something and blow it up, it's called insufflation. Or during digital or penile penetration in non-pregnant. Well, they say here non-pregnant women can get it. When air enters the vagina, travels through the cervical canal and the amniotic membranes. So it has subplacental sinuses. That's where the problem is. So you got the placenta, and then you have what they call sinuses, which are just pools of blood where exchange is happening. And pregnant women can lead to death for the mother and the fetus within minutes. Now, here it says in non-pregnant women, air can enter the venous circulation through vaginal lacerations. Okay, that is highly unlikely.
That would be a very traumatic.
And cause acute right heart failure. You would have to, this, again, another Eli Roth type situation where you're just taking an air compressor.
Right.
Well, maybe that's happened. I mean, people have done stupider shit.
Yeah, that's true.
When I was medical examiner, I used to get the journal. It's called NAME, it was National Association of Medical Examiners, and this journal was just one horrific death after another.
Oh, gosh.
And one guy died. Get that? This is, you have an infinite number of instances. You're going to have infinite number of things happen. This person mixed up Quickcrete and gave himself an enema with it.
Mm-hmm.
Now, I'm not sure what he was trying to accomplish, but what he didn't realize was that concrete is an exothermic reaction. In other words, it gives off heat.
It's hot in there.
It gives off heat as it crystallizes, and it cooked him to death from the inside.
Yikes.
Yeah, it was bad.
A terrible idea.
Yeah, not a good idea. Don't do that. Champagne enemas, don't do that.
No.
You absorb it too fast and you can't control it. And you can get alcohol poisoning and even die. We had somebody in the National Association of Medical Examiners die from champagne enema.
Oh, goodness.
Just drink it.
Yeah, drink it.
It's
Tastes
tasty.
great.
Yes, just drink it. Stop putting vodka under your eyelids or soaking tampons. We proved on this show that does not work. That was before Dr. Scott's time and PA Lydia's time. We had a woman come in and volunteer. We soaked a tampon.
We tried that in college.
Well,
failed.
Right. Well, and people are trying to, if they're underage, they're trying to drink without drinking so they can go to a party and be drunk or whatever. But we soaked this thing in vodka. And maybe I'll post this episode on my Patreon because it's not available elsewhere now. And every 20 minutes, we did a breathalyzer test on her. And it was 0 every time. She's got nothing, which makes total sense. What's the one thing the vagina is not made to do? Absorb things. It's made to be a conduit for semen. Believe it or not, there's a purpose for it, other than just, jamming your member in there and going in and out and in and out until stuff comes out. There's a, there's a reason for it. And when semen is deposited in there, you don't want it to absorb. You want the sperm cells to end up through the cervix into the uterus, where it's going to find, not in the fallopian tubes, Dr. Scott. That's where you don't want it to
That'd be
happen.
awful.
Then
But you want it to meet an egg somewhere in a hospitable place in the uterus.
Yes.
It's amazing any of us are even fucking here when you think about it.
Yeah.
When you put it that way. But that's what it's for. So it's not made to absorb things.
Mhm.
Now, if you don't do this. If you shove that same tampon up your rectum, then you would absorb some of it. But please don't do that. I'm telling you, don't do that. It's stupid. Just drink it responsibly.
Right.
Fuck's sake.
Hey, before you get out of here,
Yeah.
Diesel Child thinks he needs a bell for his beautiful question.
Okay.
I think a bell. I think a bell's reasonable.
Yeah.
Get your hand off my penis!
There you go.
Give thyself a bell.
There you go.
There
All
you
right.
go.
All right, my friends.
Cool.
There you go.
Yeah, let's get out of here. We will be playing some music. Mel B was supposed to demonstrate her skills on the guitar after doing the roadie coach, but we'll do that on the after show. And thank you all very much for being here. And thanks always to go to Dr. Scott, PA Lydia, Mel B. Tacey's not here today. She had to work. Go to our Sirius XM show on the Faction Talk channel, Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website, drsteve.com, for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get you off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.